Hi everyone. So today we'll be talking very quickly about the causes of emesis. And as you can see here, I've kind of broken it down into three branches. The categories include intraperitoneal, extraperitoneal, and then medications plus metabolic disorders. So when we talk about the first category, intraperitoneal, there are four subcategories. The first one is obstruction. So this includes your pyloric obstruction, small bowel obstruction, colonic obstruction, and then in rare cases, especially in your thinner individuals, something called nutcracker or SMA syndrome. That basically is when the duodenum kind of compresses the SMA artery, leading to abdominal pain, weight loss in some patients, and then nausea, vomiting. Within the same category or subcategory of obstruction, I also would like to talk about Zenker's diverticulum and achalasia. And during the history portion of the patient encounter, the patient tells you that the emesis is mostly undigested food, then you probably want to consider Zenker's diverticulum, achalasia, or something, if rest of the workup is negative, something called rumination syndrome. And then the next category is more straightforward. The enteric infections, so both viral and bacterial gastroenteritis, can lead to nausea, vomiting. Inflammatory diseases, so these are your itises, so that includes cholecystitis, pancreatitis, appendicitis, and then hepatitis. And then the last subcategory is altered sensory-motor function. The common ones in this subcategory being GERD, gastroparesis, and the cannabinoid syndrome. Moving on to the next category, extraperitoneal. And the way I like to look at it is, how we talk about referred pain. You can consider it as referred nausea, vomiting. So the cardiopulmonary disease, that includes your myocardial infarctions, your pulmonary embolism, pneumonia, things like that. Then the labyrinthine disease, so that includes labyrinthitis, malignancies, and motion sickness. Intracerebral, so that's within the brain. So again, malignancy, hemorrhage, abscesses, and then also hydrocephalus, whether it's a younger patient or normal pressure hydrocephalus as well in older individuals. The last and the most important category is psych, anorexia and bulimia. They definitely can present, they're inducing emesis, but they may present it to you as I'm having nausea, vomiting. And then depression, anxiety can also present with emesis as well. But it's still unclear, is it because of the medications they've been placed on for depression and anxiety, or is it depression and anxiety itself? There's a whole studies on the possible lack of serotonin playing a role, but it's not very clear. And then the last section is medications and metabolic disorders. There's a lot of drugs that can cause nausea, vomiting. I'm not going to list all of them. But the ones that are important are your cancer chemotherapies, antibiotics. Digoxin is the one that gets tested on a lot during boards. Oral contraceptives as well. Toxins, I think the two main ones that I think about when toxins causing nausea, vomiting, I think of liver failure. And the reason why liver failure is in there is because of the increased concentration of ammonia. And ammonia is actually very toxic in our bodies, where urea is much less toxic. That's why our liver does a good job of metabolizing or converting ammonia into urea. So if ammonia builds up, it leads to hepatic encephalopathy, but before that even develops, nausea, vomiting, it may or may not be present. The other thing that I think about is ethanol. Is also another toxin that can lead to nausea, vomiting. Last but not least, the metabolic category. So this includes pregnancy. The mechanism is still unknown of why pregnancy causes nausea, vomiting. But I think one of the main culprit that I've read upon is the increase in estrogen concentrations. And then uremia, so whether it's an AKI, acute on chronic kidney disease, can definitely lead to emesis as well. And then both alcohol and diabetic ketoacidosis, thyroid, parathyroid disease, and last but not least, adrenal insufficiency. So this was a very quick video of just going over the different causes of emesis. I hope it was beneficial for education.